good afternoon, everybody. If you haven't met me before, I am Katia Noyes. I'm a faculty in the School of Public Health and Department of Surgery. And I also direct the core for multidisciplinary collaboration and teamwork for UB CTSI. And this is the group that providing you with the with this workshop series. And so if you register for all the workshops, but for whatever reason missed, they all recorded, and you should be able to find the link. Can you see my slides?
Yes.
And in the right mode, right? You see the presenter mode? Okay, perfect.
Yes.
All right. So just to remind you, this is the workshop number 3. Last week we had Dr. Gabriela Popescu, and she talked about how to be a PI and a team leader. And so she provided a lot of very useful suggestions and tips on how to run this very specific type of teams where you are the owner of the team, you are the goal setter of the team, you are the team leader and your team manager. Okay, so if you missed that, feel free to rewatch. So today we're going to talk about a much broader type of team leadership, not only in the teams that you created, but on the teams that you didn't create, on your clinical teams or work groups that may function like teams. Not all work groups are teams, but many of them are. And sort of teams where the leader may not necessarily be the manager, or at least not be the manager all the time. So those could be 2 distinct roles. Okay. All right. So obviously, we talk about leadership all the time, and we assign a lot of great values to our team leader. And so sometimes it's really the leadership that brings team to a success, just like with a French soccer team that was unanimously thought that the reason they won the 2018 World Cup is because of their team captain, who is also their goalie, Hugo Lloris. This is one of his quotes, that the good leader is not the person who talks the most, it's the person who talks the most sense. So that's, I find it very telling that it's not the amount of time you are in front of the people, it's not how tall you are, it's not how many degrees you have, it's really the skills that you bring to the teams and your impact on the team performance that makes you a de facto leader. And of course, leadership exists in many different forms and in all sorts of industries and sports and IT. And there's no one size fits all in leadership, and different companies and different industries require different leaders. But nobody would argue that the leadership, the personality of a leader always reflects on, I would say, perception of the company, productivity of the company, and the long-term success of the company. See Microsoft and Bill Gates. So just to remind you, sort of, what is a team? So we defined team multiple times already, and sort of team is really starts when people agree that they have a certain degree of interdependency, that they can accomplish their task or their goals alone. They need their team partners. And in order to do that, they have to coordinate and share and manage their resources, whether it's time, people, patients, equipment, whatever that may be. And the only way how they can do it effectively is that they are comfortable and safe in sharing both positive and negative feedback and sharing information, which we define as this psychological safety. All right, so this is a team, right? So where is a leader here? Who said we need a leader? Why can't this framework operate on its own? Anybody has any thoughts? Why do we need leaders on the team? Maybe we don't need leaders on the team. Maybe it's just the person who wants all the glory. And that actually, if it's a really good team, the team will function on its own. Any thoughts?
I think you need someone who will spearhead the operations, who would keep things together, who would basically, quote, lead people into the right direction, into doing the correct things, and just to keep the team together and give them some willpower and strength to carry on.
Yeah, that's a great comment, but we all sort of struggle with this idea. You know, there must be a leader, but it's really not easy to define what is it that leader has to do. So that's what we're going to do today. We'll try to define exactly what leaders do. And again, Dr. Popescu defined very well last week the difference between manager and a leader, which in her example, in a lab, in a research lab, very often is the same person, it's the PI. And so the leaders, as was said, they set up the direction, they set up the goal, they come up with a motivation. And the managers, I really break it down into pieces and make sure things are done. They're done by the most competent person, they're done in the right time, in the right format, according to the standard, et cetera, et cetera. So leadership and management are quite distinct. Just being a good manager doesn't make you a leader. And I can think of many leaders who are terrible managers because they really cannot be bothered with that level of detail. So it's great that they're complementary, but it's not always the case. So for those of you who watch the Mad Men, so you know who the de facto leaders of the marketing agency were. So there's a Don Draper, and there is Roger Sterling, and there's Bert Cooper and Pete Campbell. But the agency will not be able to function without Joanne Harris, who was the chief of staff and basically a glorified secretary. You just cannot imagine those four brilliant men being able to get things on time in between all of their extramarital affairs and everything else that was going on, right? Which is not necessary. So managers and leaders work together, but they don't replace each other. So let's try to sort of break it down into what effective leaders do. Again, it was said early, so they develop a plan, right? It's not the manager who develops the plan. Manager breaks down the plan, but it's really the leader who sets up the goal. It's also up to the leader to assess performance of individual team members and provide them feedback. Sort of when we were talking about storming, norming, and performing, that cyclical process of the team growth and development and changes, it's the leader who initiates that process and recognizes that something is not going according to the plan. It doesn't have to be only the leader. In a good, psychologically safe team, anybody can bring it up, but it's up to the leader to initiate that process and create that culture or establish a team culture. So we talked about resources, we talked about feedback, sharing resources, creating culture of sharing, and then there is this responsibility that most of us probably would like to avoid at any cost if you've ever been a leader, but somebody has to do it. It's managing conflict. And again, in my first workshop, I mentioned that one of the myths of teamwork is that good teamwork is always about harmony. Everybody holds hands and they march together with a smile in the same direction. In reality, those teams are very rare. It's this productive conflict and professional disagreement that creates the innovation and diversity of opinion and process of perfecting solutions and getting to the right answer. So managing conflict and facilitating conflict is not necessarily a bad thing. It's not in the kindergarten, somebody took my toy away. It's somebody disagrees or have an alternative suggestion for a strategy, or perhaps a process, may provide some feedback or criticism of the plan and alarm members of a team that certain conditions may not be met. It's really bringing your unique expertise, whatever your role is on the team, and informing others how your knowledge may change the current plan or current work. Any questions at this point? So in order to be able to do that, to perform all those functions, what boils down to what's important to the team leaders is emotional intelligence, because success of the team turns out to be really it's a match between the team goals and the team composition and the team culture. You can't take any team and assign it to any goal. The goal and the team has to match. You probably heard this expression, is that one of the tasks of any new leader is to take the wrong people off the bus and to put the right people on the bus so the bus can go to its destination. If you don't have the right people for the task, you can't accomplish a task. And it's a role of a team leader to understand that, to assess that, to articulate that, and to be gentle enough to take our own people off the bus and perhaps reallocate them to a different project or send them to seek happiness elsewhere, and then to identify and engage the right people and bring them on the team and help the team gel so that they can actually have a chance to achieve the right task that they were set to achieve. Thoughts, questions? All right. So because of this tremendous importance of facilitating and managing conflict, I wanted to spend a little bit time of talking about specific strategies, how to deal with conflict on the team. So this is a phenomenal consulting company. It's called Future Work Design. It was started by 4 women with very complementary skills in organizational psychology, education, marketing, and they create this terrific, very short cartoon-like scenarios, basically mini workshops, a couple minutes long. So when you look at your presentation, you can click on any of those links. I don't want to play those cartoons, but I'll explain to you those different strategies, how to deal with different types of conflict on the team. So this is Nina Norell. She's one of the partners of this company, and so she's sort of explaining each of the scenarios. So let's go through the first scenario. So, and they have very catchy names, so if you hear it, you'll remember it. So one of the conflict resolution strategies that we call pinch crunch. And the idea is that often in our daily work, especially on the teams, there are feelings or thoughts or situations where things are not going well with your team members, but you brush them aside because you have this big task. It says, okay, it's really not important. It's too small. I'm not going to worry about it. But over the time that teams work together, those little things tend to accumulate. And if those disagreements or problems are not resolved, eventually they're going to blow into this huge problem, and there's going to be a fight or a conflict or a blow, and very likely that the team may not be able to survive it and will fall apart. So the strategy here is, rather than ignoring small problems, think of them in the time that they arise and address them before they snowball into this big, disastrous, life-threatening situations for the team. And you can probably think of those in your professional life or even personal life all the time. Kids not picking up their clothes and leaving dirty dishes on the table. Sort of you wait and you keep cool and quiet, but by the end of the night or by the end of the weekend, you just blow off and send them all to their rooms without TV, right? So this strategy really reminds us that teamwork requires maintenance. You can't just postpone it. You can't save it until the end of a project. That conflicts are going to arise and they need to be addressed as they arise. Okay. The second strategy, a concept, again, and they're also visual concepts, sort of, it helps everybody understand By the way, did anybody have any questions about the pinch crunch idea? Has anybody sort of used it intuitively or arrived to the same conclusion, or everybody's waiting for the crunch? No. All right. So the waterline idea is that when the team is working well, so we should be gliding on top of the water and swimming towards our destination. And then things are not working, you start having this feeling that you're drowning, that you're not moving fast enough, you're spinning wheels, you're putting too much energy and the things are not working the way they should, or you're openly having a disagreements with your team members. So you're going under the waterline. So when you catch yourself and your team in that situation of drowning, going underwater, this is a time to stop and regroup. So this is again going back to forming, storming, and performing. That this is an indicator that your team is not working well, which could mean a couple of different things. You may be missing an important team member with important expertise. You may have disagreements on the goals, or not everybody understood the goal in the same way. So you may want to refresh and clarify the goals. It may be the way how people communicate, or sharing or not sharing information or resources. Or it may be that somebody's interpersonal issues. They may feel that they're contributing more to the team that they get back. They tend taken for granted. Maybe they no longer feel comfortable speaking up, and that sort of affects the team performance. So any of those problems could result in this team feeling of drowning. But the only way to address them is to acknowledge that there is a problem and do an evaluation of both individual and team behaviors, and try to get back on top of the water so we can glide towards our destination. Right? All right. Oops. And so the third suggestion is really a strategy for communicating conflict. And I'm sure each of you has been in conflict situations, but let's say one of the team members is always late to the team meeting, and everybody has to wait, and then you have less time left for the meeting process, and people are aggravated and nobody's want to say anything, and everybody thinks that person is a jerk. But if you start a discussion with, we all think you're a jerk, that's not going to be a productive professional facilitation of the conflict. It will be a fight, and you may lose your team. So the strategy that this group suggests for addressing a conflict is start with, I notice you're always late. That's sort of objective statement. Yes, that person's late. But then it's important to follow up, I feel. Again, not starting to attack the person who is late, but stating that I feel disrespected, or however else I feel bored, I feel I'm wasting my time. And then move to I think, which is really your opportunity to express your view of the situation. I think you are not committed to our team. You don't know that for sure, but that's why you're concerned. And that's why you want to address it. And then the fifth part of this wheel of mindful is I want, which is really how do I want to compromise? How do I want the situation to change? And maybe realizing that it may be not possible for that person to show up on time, but maybe we can schedule a meeting another time that is more comfortable time for everybody. But what I really want is that everybody shows up on time, and that we can be productive and we have everybody's attention for as much time as we need. So helping you process your conflict in this sort of systematic, consistent, and factual way, in many situations can resolve the crunch and the blowout, and reiterate the purpose of the team, that we value you as a team member. That's why we're waiting for you, because we need you there. but please value our time as well, because we need to be there together in order to achieve that. All right, but so these three examples, sort of different strategies to deal with the same problem. And sometimes you may want to use them with sequence, and sometimes you may feel more comfortable using one or the other. But the goal is, again, to diffuse the conflict, and whenever possible, take a lesson from that conflict if the signal is that something needs to be improved or a change for that team to be more effective and productive. Questions? All right, very good. All right, so then we're ready to do one of our exercises. So rather than calling it a conflict, which may create some rise in blood pressure for some people, we'll call it agreement. If you're on your team and you suspect that one of those situations is happening, we're either drowning or we have some problems going on, but it's not quite clear who and why people disagree, it is safe to do this sort of a team temperature management, to pose a question of which you think there is a disagreement, and allow people to express their opinion. Do they wholeheartedly endorse this idea or the strategy or the goal or the method, or would they veto and sort of present it as a continuous scale? Okay, so the first question we're going to try, and this is just an exercise. So Liz suggested this statement. So chips and dip is a good party food. Okay, so now if Marcel will let us, we will vote on the poll. Everybody sees the poll, so feel free to pick the option that fits your feeling about chips and dip. And submit. Okay, did everybody see the poll question? Did it come up? Were you able to respond?
Yes.
Yes.
Okay, do we have the answers, Marcel?
No, not yet. People are still answering. 17
Okay,
out of
good,
20.
good, very good. Take your time.
Okay, so right now 85% participated. Do you want to see the results?
Let's see the results.
Okay.
All right, so more than half of people wholeheartedly endorse chips and dip. There are some disagreements, so there are a few people who seriously disagree. And so if we are in the party organizing business and we're really more seriously thinking of providing dips and chip, so perhaps we may want to discuss with those alternative groups and accommodate them, or not, depending on what we feel. But we got a pulse of this group. Okay, you got the idea. All right, let's try a different question now. So where is my, okay, so let's try fall is the best season, and let's see how people feel about that. Okay, so look at this now. So we really don't have a leader, right? So less than 30% of people like fall. Some people have reservations, but the group of people who needed more discussion and basically didn't like it, didn't support it, and had serious disagreement is also close to 50%. So regardless of the question, when you pose a very direct question to your team, you may be able to identify, and it may take a couple questions to figure out what is it that causes disagreement? Why are we spinning wheels? Why is the enthusiasm suddenly dropping and participation is minimal? So that may help you, because some people will vote with their feet, some people will be passive aggressive and don't say anything, but sort of look hurt. And doing this kind of a temperature measurement or assessment may be a quick way to diagnose exactly what is it that's causing a discord. Question at this point. Okay, And again, it's a responsibility of the leader to detect the situation and address the situation, and then based on the results, come up with a strategy. And maybe the strategy is discussion. Why are we not agreeing? Maybe we agree when we started and we're not agreeing anymore. And sort of depending on the results of this exercise, different teams may choose very different strategies, but it's the leader who initiates the process. So let's talk a little bit about the type of leadership, also to help us understand what we expect from the leaders and how we could be better leaders. So again, Dr. Popescu talked about those permanent leadership styles, sort of people who have a tendency to be commanding or people who have a tendency to be coaching. That typically doesn't change. That's a part of a person's personality, and that's how they behave in all aspects of their life. But there are other situations where what we call adaptive leadership is necessary, that something in the team dynamics or team environment may change, and the leadership strategy may need to change. So not anything fundamental about the team, sort of not the team goal. If the team goal changes or team mission changes, you may realize you need a whole different team. But maybe if you're a clinical team, and you work in a rural hospital, your hospital got purchased and merged with a large healthcare system. And sort of your team dynamics may now change. I mean, you may need to add new team members, or perhaps your previous team leader is now also responsible for other teams and may no longer have that much time. And it may be a temporary situation, maybe a permanent situation, but this idea of adaptive leadership, which is very important in the current environment because things do change very quickly. And even before COVID, there are lots of other moving parts in the way how we did our work, and either clinically or in a research setting. So it's important to understand and use adaptive leadership as one of those practical tools that may help team overcome challenging times or unusual circumstances. So let's look at some specific examples. So Liz found this terrific vignettes that should be familiar to most of people, and I'll play some of those videos so you can better understand what I'm talking about. Can everybody see the screen?
Yeah, just make it full
Yeah.
screen.
Now what do we do? It's obvious, isn't it? We're gonna play our way across the room. All right, Harry, you take the empty Bishop Square. Hermione, you'll be the Queenside Castle. As for me, I'll be a knight. What happens now? Well, White moves first, and then we play. Ron, you don't suppose this is going to be like real wizard's chess, do you? You there, D5!
All right, I'm going to stop here. So you got the idea. So, so what are we seeing? What happens with leadership? So who is the leader? This is Harry Potter, by the way, if you didn't recognize it. So
Ron.
in the Harry Potter, so not Harry Potter is usually the leader, right?
Oh, Harry Potter is the leader, yes.
Yeah, but in this situation, he's not the leader. He doesn't know how to play chess, but Ron does. And so this situation where Ron switches his role and he becomes the leader for that battle, he now has a strategy and directions and articulate the message to other team members and they listen to him because they know that they need him in order to survive and get through this. Okay. All right, so let's look at another example. People familiar with this movie?
Prepare to fight. If we die with honor.
Okay. So this is the usual permanent team leader. He leads his army.
Yeah. Aim the cannon at Shan Yu.
Enemies attacking.
All right, you might want to light that right about now. Quickly, quickly! Come on, we gotta help!
So this was his strategy to cause an avalanche. That is going to destroy the enemy's army. Okay, so what happens with leadership in this situation?
Someone else took over.
Right? And why did he take over? Because he had this brilliant idea that nobody thought about, but this relatively junior person, we don't know about psychological safety in that group, but presumably he was able to get away with it, got a brilliant idea that his leader in command could not think of, and executed it successfully. And so for that situation, he actually provided leadership, perhaps didn't articulate it clearly, there wasn't any coordination, but there was an emergency situation. So, but that's sort of another example of adaptive leadership. Not that I would endorse it, run away with resources and do it ahead of your dean. Not sure how it's going to go, but in appropriate situations where the life of the entire army is at stake, we can argue that that was appropriate solution, and especially when everything ended well.
Not to get too deep, but don't you think a little bit of it too is because she's a woman pretending to be a man?
Right. Okay. That even deeper, but we'll leave it for the next discussion. All right, so those were very remote examples, but now we can look at sort of things close to home. So the study section, if you've ever been on the NIH study section, there is a chairperson, there are many members who actually read a lot of different grants, but then there are also NIH scientific review officer, people who work for NIH and who are there to ensure adherence to all the protocols and the guidelines and the rules. So under normal circumstances, a designated leader is a chairperson, and he or she would be calling up the names, reading the grants, making decisions. But in many situations, the leadership may go to the review officer when the guidelines are unclear, when the chairperson may have conflict of interest, when an unusual situations may arise and we need an external consultation, or we're running out of time. So there are many different examples where those two people are going to sort of dance in tandem and switch roles. And maybe other people on a team. So typically if a chairperson has a conflict of interest, there would be another member of the study section who will be chairing that particular application discussion. And again, in order for this all to work smoothly, everybody needs to understand the rules and probably discuss them ahead of time and agree ahead of time. Sort of there needs to be a communication, there needs to be a resource sharing, especially now when we're doing it over Zoom, everybody has to have the right paperwork. So in order for that study section, which is 2-day grueling process, in order for it to go smoothly and everybody get a fair review, this team has to function as an actual team, not just as a committee. So for a clinical example, I wanted to share with you this sort of cartoonish version of the surgical team in OR. Very traditional team. There's an anesthesiologist, number one, a surgeon, number two, a nurse anesthetist, a technician anesthetist, number three, right there on the side. There's a scrub nurse back to us, and there is a circulating nurse or a tech who is in and out doing the coordination. So under normal circumstances, who do you think is a team leader here? Surgeon, of course, right? That's what everybody thinks. The surgeon would be the leader. Liz, are you there? Dr. Kaler?
Yes.
Yeah, so what are the alternatives? When is surgeon not the leader on this team?
Well,
let's say it's a very junior surgeon and very senior anesthesiologist, and blood pressure is dropping or oxygen is dropping. They switch their roles, and then anesthesiologist will take control, because the first thing is patient safety and making sure that the vital signs stay in the reasonable range. Is that a possible situation?
yeah, it's possible. I mean, usually the anesthesiologist would notify the surgeon, and the surgeon would say, I don't see any blood loss on the field. And that would, to some extent, put it back to the anesthesiologist, at least to consider other things. But there's other things on the field that could lower the blood pressure, and
Yeah,
everybody's mind would be at work.
Yeah.
I think like everybody has like a heightened concern and is sort of thinking, and maybe really what happens is, I mean, a lot of times it's the nurse anesthetist, so I'll say, call your attending. You know, I guess the junior surgeon could ask for backup.
Yep.
But I think it's really the person who has, I don't know, I think it's personality. You know, because you could say, oh, let's get a chest x-ray and rule out a pneumo, or let's call cardiology to do an echo, or maybe the anesthesiologist knows how to do the echo. I mean, like, people have different competencies, and I think like whoever's has the personality to take charge would do so. But I think like in the OR, the surgeon tends to have the ego that makes them think they're in charge, and then so they try to be.
Okay.
I'm glad you said it makes them think that they're in charge, because from my understanding from going to medical school, in an operating room, the number one person is the anesthesiologist, because the primary role in that setting is to keep the patient alive and safe. And that's why the number one is on the anesthesiologist. That's from my understanding.
Okay. Has anybody seen a situation then a scrub nurse may become a team leader? A sponge is missing, or
Yeah, I was about to say when a gauze sponge is missing,
Yeah.
yes.
and then
And I'm a previous cardiac nurse, and I would pull sheaths. And in a previous setting, there was a resident that was new, and he was not very. He did not have a lot of experience, and so I personally had to take over in an emergent situation in order to save the patient from hemorrhaging. So in that situation, I did take over because I had much more experience in that situation, and we went from there, and we collaborated very well.
which means that that was a terrific functional team because you felt comfortable taking over. They felt comfortable giving leadership to you. And everybody had the same shared goal, not to save the surgeon's ego, that wasn't the goal. The goal was to save the patient and have the best possible outcome given the situation. And that team succeeded. Okay, so these are examples of adaptive leadership. So in the case with NIH panel, it is planned. We know there would be conflict of interest and we're going to switch leadership. And in the OR, it may be an emergency. Nobody planned for it for this case, but we plan for it when we practice and when we train and we do simulations. We plan for emergencies as a part of training. If something happens, we have a plan B and C and D. Okay. Any questions about this?
The only other thing is, I think another reason the surgeon tends to feel the most responsible is it's their surgery. They're the ones that got consent for the surgery.
Right.
We'll end up talking to the family afterwards. So to say something like, oh, well, my side of the table looked fine. I don't know what, like the anesthesiologist didn't step up to the plate or whatever. Like you can't take that stance. Like, even if it's not your expertise, you're asking what is that feeling of responsibility is there more so, I think, for the surgeon than anybody else. But
Yeah.
I'm not saying others shouldn't step up to the plate if they have the competency. I just think that the feeling of responsibility is highest for the surgeon.
Yeah, so what Dr. Kaler is talking about is a very important point that under current guidelines and regulations, it's the surgeon's name that appears on the case, not the anesthesiologist, not the nurse. The case is attributed to the surgeon who was scheduled for the case, sort of not the assistant was called. And so because of that, the legal responsibility falls on the surgeon, which in these situations, if we're sort of looking globally at the team, that's part of the environmental, part of the environment where this team operates. Even though de facto they work as a team, legally, unfortunately, in the current situation in the US, they are not perceived as a team. And so the way to overcome that pressure, unnecessary pressure on the surgeon to always act as a leader, even in the situations when they don't feel as a leader, is perhaps to have an institutional policy where the responsibility for good or bad things or M&M discussion, morbidity and mortality conferences, when something goes wrong, involves all members of the team. Not only surgeon gets called on the stage, but the whole team will attend and everybody will have an opportunity to express. So the legal responsibility may still fall on the surgeon, but the peer responsibility is more equally distributed across all the team members. Has that ever happened in M&Ms, Dr. Kaler? So when, let's say, patient died on the table and it wasn't surgeon fault, would the whole team be invited to M&M to discuss?
No.
No.
Oh, I mean, M&M is mostly amongst surgeons. And if there was a root cause analysis, then it's different by different hospitals. So in some cases, the team would be there, but in most cases, some nurse usually goes around and interviews everybody and then brings back their findings to the team, who happens to be, you know, more of the leadership of the hospital and of the department.
Yeah.
I don't know. I know in transplant we have a lot of different people at the table, but even then it's not like everybody in the OR. It's everybody in transplant. Sometimes we invite different people like cardiology or whoever we think would be most contributory. But I agree with you that that would be a novel and maybe useful way of going about it. Although it would also probably create, like, there'd be new knowledge, but it also results in people hearing things they don't want to hear.
Yeah, complicated. And again, the point here is not to pick on surgeons. The point is to look at the real example and recognize that sometimes there are external pressures or external factors that may impact how certain members of a team act. And so again, in healthcare, the classic example is a reimbursement. If you paid for RVU, you will act providers who pay by RVU, by volume, act very differently than providers who receive salary or capitation and don't have an incentive to do more cases. They may spend more time with patients. They may have more discussions and longer evaluations. So there are many factors, and the role of the leader is to understand those incentives and try to align the incentives with the core mission of a team as much as possible, so that everybody's best interests align with the interest of the team. All right. So I would like us to do another group exercise. So for those of you who attended the first workshop, it's the same case of the primary care practice that's missing a triage nurse. Only our task today is going to be different. So as we're watching all together, as we're watching the video, I would like you to pull up your assignment sheets, however you want to use them, on your phone, on a piece of paper, and track whenever you see any of these behaviors, team behaviors, engage team members in define and modify the plan, reviewing team performance, rules of engagement, etc., resolving the conflict. Try to identify who is addressing it. Is it the team leader? And the first question for you would be figure out who the team leader is, and then assign that behavior to either a team leader or to a different member. So when we finish watching and doing the assessment, we can break you into a small group. So we can probably have 3 groups of 5. And you can talk within each of the groups about your observations and see how sort of consistent your findings are. And then we'll come back and hear from every group. So just in case you missed, so this is a map. So you have Emily, the receptionist. You have Dr. James. You have nurse practitioner Kelly. You have another internist, Dr. Schwartz. There is a PA, an RN, and another RN. Okay. All right. So I'll give you a few minutes to locate your assignment sheet or evaluation sheet. So you have it in front of you. And then we're gonna watch the video. Okay, is everybody ready?
James and Schwartz, how may I help you? All right, feel better, Caroline. I'll pass it on. Excuse me, Dr. James?
Yes, what is it, Emily?
Carolyn just called in sick, and she's the triage nurse today.
Okay, do me a favor, gather up the staff. We will need to do a quick huddle at the front desk before the day begins.
Got it, right away.
Okay, perfect. I'll be there in 10.
Okay.
We're swamped today. It's flu season. We don't have time to stand around.
I know, but Dr. James called this huddle. He should be here any minute.
Good morning, everyone. I need to tell you that Carolyn called in sick and she was assigned to triage. So we have 3 providers here today, so we'll take turns covering for Carolyn. During your triage shift, you'll see your scheduled patients every 30 minutes instead of every 15. Any patient you can't see will be passed off to another provider during your triage shift. That way we can ensure that anyone who needs immediate care is appropriately seen. Any questions? No? Okay. Be sure, everyone, to explain to our patients that the wait may be a little longer today, but we're doing the best we can, all right? Thanks, everyone. Let's have a productive day. All right, sir. If you'll just have a seat right over there, we will get to you as soon as we can, all right? Thank you.
We're going to see you right away, so why don't you come on back in? It's that first floor there on the right.
All right, sir. We'll get with you as soon as we can, okay? You can have a seat back in the waiting room for us. Thank you.
Excuse me, everyone. Can we have a quick debrief about today's events? Kelly, Sam, is that everyone? Yeah. All right, good. So, what do we think about how we handled our workflow today without a triage nurse?
I'll start. When I first heard the news this morning, I was a bit wary, but from the moment you called the huddle, I felt fine.
It was busy, and everyone was alert and acted as a unit. We seemed to communicate well and pulled it off just fine. I'd say it worked for us.
I'd agree with Dr. Schwartz. I mean, although this isn't something that I'd commit to on a daily basis, I think it would work as a last resort. I mean, we managed to come together as a team and support each other, and that led to a successful day.
I think it went well. Thanks for great leadership today, Dr. James. It helped us all ease into the situation confidently. Everyone appeared to be aware of what was happening and adjusted to make sure the patient's needs were met.
Don't forget Emily. She followed up with Dr. James immediately.
Thanks, Kelly. So if a triage nurse does call in sick again, should this be the plan of action?
That's a good question. From everything I've gathered today, this does seem to be a completely viable solution. So if everybody is comfortable with it, I think we should adopt this as the new default. Everybody on board?
I might just suggest that we have a provider or a triage nurse on call for this situation specifically. I feel that our patients shouldn't be passed around unless completely necessary.
Point taken, Miles. I'll look at the schedule, see what we can do about getting somebody on call. Anything else? All right. Well, excellent work today, folks. Let's close this place down and go home, all right? All right.
All right. Any questions about the video or the assignment? Okay. So Michelle, if you can organize us into small groups, we should have about 10 minutes to talk among ourselves and compare our notes.
Good. Everyone just needs to join it. It should be on their screen.
Thank you. All right, is everybody back?
Yes.
All right, we lost some troops somewhere in the space, but yeah, so I hope you guys had a productive discussions. So were there any roles that were only, oh, by the way, who was the leader? Who did the groups think was the leader? Hello.
The doctor.
Yeah, I mean the doctor.
The
doctor did, but it looks like the receptionist took over, in the end. That's what I thought.
Okay, let me make sure. So Dr. James, I assume, right? Because we also have
Dr. James. Yeah,
Dr. Schwartz. Okay.
Dr.
All right.
James.
Yeah. So were there any behavior that were exclusively demonstrated only by the leader? What did your groups observe? Was there
I guess
any
you could
behavior?
say the modeling behavior.
Okay, very good. Anything else?
Well, he told people what to do.
So
Told people what to do.
right, so he allowed feedback, right? People question and argue, but he started the process. So engaging team members, I think that was really the leader's role.
Yeah, I would also say he reallocated the resources. We're missing one resource, so this is how we're going to make that up.
Okay, very good. What about conflict resolution? Have any of you observed any conflict? It wasn't a violent conflict, but was there conflict?
Yes, in the end, when the physician assistant suggested, that we need to have something else,
Yes.
As a model rather than a default. Yeah.
Yes, and so how was that handled? And who handled that?
Handled appropriately, by the team leader. He totally look into it and we'll see what suggestions we can come up with it. Even though he had no suggestions right then and there, but I think that is appropriate answer right there.
So he was supportive, right? He acknowledged and was grateful for the suggestion. He didn't shoot him down and said, what a stupid idea. How do you think we're going to do that? We don't know if it will get implemented or not, what will happen, but the discussion of this alternative strategy was collegial and supportive. What did you think of that very beginning when Emily hurdles everybody together and they said, we don't have time to waste this morning, we're very busy? And what did Emily say? She said, look, we really need to be together. We have a problem today, and Dr. James is going to come with a solution, right? So in that situations, I thought Emily actually diffused the conflict very well. And also, so she, even though she's probably the lowest on the social hierarchy, in that situation, she acted as a leader, bringing people together and sort of helping them recognize that the change is coming because we have a very unusual day today. Okay. So I thought that sort of, were there any other observations about this team in particular? What helped them have a productive day and accomplish what they needed to accomplish at the end?
So my take on it was, although they got through the day and maybe did the best they could do, I wouldn't call it, maybe it's productive, but I wouldn't call it successful because the patients were waiting.
Yeah.
And it was not good for the patients. And then in the end, when he asked for feedback, everybody acted like it was a fine solution, except for the PA, when in fact it wasn't a fine solution. And I felt like they were maybe not being honest about it, or they just didn't care about the patient having to wait.
Yeah, that's a very good point. That's a really good point. So from their team perspective, they were fine, but the output of their team should really include patient satisfaction. It would be interesting to actually be a bug on the wall and hear what patients had to say about this arrangement. That would be very informative. Yeah, no, that's a good point. Okay. All right, so again, some examples of leadership, some examples of adaptive leadership, and some strategies how to handle this fluidity in the team dynamics and team environment and modify as we go. So before we wrap up for today, so there is this great theory, or perhaps a myth, that great leaders are born, not made. However, the evidence doesn't support this idea. The evidence actually demonstrates that leadership could be taught and could be improved. And there are many strategies and training, formal and informal. And sort of here are some of the ideas that of how to raise a productive team leaders that could apply to our academic and clinical settings. And so, not surprisingly, leaders, just like anybody else, need mentors. Just because you're a department chair or a dean, it doesn't mean you don't need mentors anymore. Just like a junior faculty, senior faculty, and team leaders also should have their mentorship. It could be peer mentorship with other team leaders. If you're lucky, you may have a senior person, or you can have a mixed leadership mentorship, but there is no point in anybody's professional development when you no longer need mentorship. And that's sort of something to keep in mind and use that as a resource. So coaching, it's sort of a more professional version of mentorship. So if you can't really put together a mentoring group, or you don't have time to do that, you can hire somebody professionally who will watch and provide feedback. So we do that for public speaking. We do that for junior surgeons, and we should really do more that for junior leaders, rather than to throw them in the water and see if they're going to swim or sink. Building professional networks is another way, sort of self-induced way of creating this mentorship, because those networks could potentially contain potential mentors or coaches, and could open the leader's view or expand their vocabulary of the strategies and approaches how to deal with different positions. And that's not only for team mentorship, it's for really any leadership that professional networks could be extremely informative. So stretch assignment, and something that perhaps a coach will do, is to encourage leaders to step outside of their comfort zone. Because if you continue to play safe and stay within the situations and assignment and projects that you've done before, it's very hard to learn new skills and new strategies, because you're not challenged enough. And so recognizing that some managed risk is a good risk in a good situation for leadership development. Perhaps, well, taking sabbatical could be one opportunity, or bringing a different team member from another organization, or taking a challenge, or taking a task that is slightly different from everything that you've done before. That may be a possibility, again, given the scenario of what we do, but stretching your limits, just like we do it in exercise and in endurance training, it's also good for leaders. It's very tempting to go and sign up for a seminar at Harvard or some other big things on leadership, but we have to be realistic that those seminars and trainings are only important if there is a hands-on component. If there is a assignment or a group exercise or something where you can actually demonstrate the skills, because leadership knowledge is not a theoretical knowledge. Knowing and doing are fundamentally two different skill sets. And so recognizing that, so I have nothing against professional training, but don't waste your time and money if it's all based on Zoom meetings. Sorry, but this is very different. You did hands-on training, but if it's just talking or reading or listening to other people speak, that perhaps not as productive as actually engaging in exercises and case studies with other people, and then reflecting and debriefing about what you learned and what worked well and what didn't work well. And of course, another tool that could be very helpful and very frightening is to ask for multi-source feedback, not only from your peers and your mentors, but also from people on your team and people who report to you, and get a comprehensive view. So in the situation, in a case study that we just viewed, perhaps they should have looked or waited for the patient satisfaction reviews first before making a decision if that strategy worked or not. So we know that medical students and residents are expected to do a 360 feedback, but in academics and in science in particular, we actually rarely look for feedback, especially on our leadership skills. And that's maybe one of the strategies we can borrow from other industries where 360 feedback is pretty common. I want to finish with a comment from Stephen Covey. So that's the gentleman who wrote this very famous book of 7 Habits of Highly Successful People, is that leadership is really about not enhancing your own career. It's enhancing other people's careers by opening their eyes to their worth and their own potential. So, which by definition means that people who pursue leadership for their selfish reasons are perhaps not the greatest leaders. And that in order to be a leader, you really have to be committed to the success of your team, not only to your own professional success. So just to wrap up, so hopefully I convince you that leadership and teams are interdependent, because leadership style really should depend on a team mission and team composition. And leadership may also require adaptation and flexibility depending on the situations that team is going through. So there is, if you're a bad team player, sorry, there's no chance for you to becoming a good team leader, because as you saw again with our second example, that modeling good team behavior is one of the most important responsibilities and skills of a good team leaders. So if you can't do it, then you can't teach other people how to do it. And of course, no matter where you are in your professional development, you can always do better by seeking help, seeking professional development and resources, and learning from other great leaders. We have 2 more seminars, 2 more workshops on teamwork. So Liz and I put this diagram for you, sort of an algorithm. If you on your team, and you can go through this sort of starting from the very beginning, do I need a team? And then if you decide that you need a team, then how to build a team and how to diagnose if your team is performing well and what to do if it's not performing well. So I encourage you to look at it, use it. I'm happy to talk about it in our next workshops, or reach out and let us know if you have any questions. But this is sort of a brief summary of pulling together all the information you're receiving in this workshop, from the building the team to wrapping up teamwork, and pulling together these different strategies and examples and exercises that we talked about in the last 3 weeks. So I am done. So next week we have another terrific hands-on workshop by Dr. Patricia Taki, more focusing on your personal strengths as a team member. So hope you can join us. And remember that teamwork can be always improved, just like leadership. So hopefully you're learning something that you can take back to your teams. Thank you very much. I'm happy to answer any questions. If you don't have questions, see you next week. Bye.
Thank you. Bye.